not often do we get to talk to the gut doctors, and the gut doctors really are, I mean, if you look at us, the backbone of our health, because we've learned so much. Don't you think in the last 10 or 15 years, Dr. Hazen, the last 10 or 15 years, we've now talked about the gut, which, in the 50s and 60s and 70s, medical school never mentioned it. Don't you love that you're now the star of the medical
I
show?
I love it. I love it. And I think, Hippocrates started with 2,500 years ago saying, all disease begins in the gut. And here we are. GI
He
is the
did.
most important specialty in medicine in a way. So,
Isn't that something? So when you first started, what you probably did a lot in clinic, and then in the OR or wherever you would do procedures, a lot of upper GIs, a lot of colonoscopies. You would give a PPI, send them home. Tell me
yes.
how that landscape, and I know you may not see patients as much now because you do so much research, but tell me so much how that has changed for you now as your vision for what you want a practicing GI to do.
Well, it's interesting. I started the field when colonoscopy just became this long tube, right? It used to be we were so close to the rectum, and it was the
Yeah, the
scope was
sigmoid,
really
right? It was a
close.
different.
Yeah, and it was you couldn't go
Yeah.
all the way to the colon when I started. And so
Wow.
when the flexible endoscopy started, it was right at the year that I started my internship and my residency and my fellowship in GI. And so it was fascinating to see the evolution of this field, and also with the perspective of as a woman gastroenterologist, I was the first woman at University of Florida 30 years ago to be accepted, which is
Wow.
kind of so
Wow.
hard to believe, right? I mean, it was
I
only 30
know.
years ago. We were literally 10 women in the associations in GI, in the meetings, right? The bathroom was empty. And now I see thousands of women. So, it's
That's
amazing, and it's an interesting field because I feel that as women we brought in a lot to GI because women are just more nurturing. They're more they question things. Well, why is
absolutely.
this like this? Why is that like that? I stepped into the microbiome,
Yes.
understanding, having birthed my two children, that when you're pregnant you're craving certain foods, and that food is the food that your kids end up eating later on. My firstborn, I
Isn't
was
that
craving
crazy?
vegetables, and that's all she ate. My second one, I was craving junk food like french fries and nachos and disgusting food. That's all the kid eats. So you can almost see that you're preparing the baby. So that whole thought, that came to me as a gastroenterologist because I also had the clue that I was carrying a child, and that kind of gave me an insight into the microbiome, into things that men would not necessarily have figured out, right? That the microbiome is passed on from the mother to the child, that the pregnancy, the whole time during the pregnancy is so important in nourishing your baby, but also making sure you're not stressed to have, a difficult pregnancy. And then, that stress can impact the birth of your child and the disease that your child's going to have. I think that was the insight that I had as a woman. And I feel that, medicine and GI has changed. We didn't look at the gut. We were just procedure oriented physicians, like let's do a gastroscopy, let's
Yeah.
put a PPI. We
Right.
didn't think, well, why is the reflux occurring to begin with? Why are people developing polyps? Now I'm seeing, now that I'm into the microbiome, I'm seeing polyps at a different world, as a different way, right? I'm seeing polyps as, yes, it's the precursor of cancer, but what if that polyp is actually developed because of an imbalance of the microbiome? What if there's a microbe in there
Wow.
that's growing and creating that polyp, right? That's how my mind's going. So I think, the idea of just doing colonoscopies, and to me, that was, you have to remember, I went from gastroenterology, to doing clinical trials, 10% clinical trials for pharmaceutical companies and 90% GI. And then
Yeah.
over the years, it became 90% clinical trials and 10% GI. The 90% time that I was spending doing clinical trials, I was doing it to advance medicine, to advance GI, to advance Crohn's disease, right? And when Crohn's disease
Hmm.
didn't have an answer, and I kept giving biologics after biologics and doing clinical trials after clinical trials, I said, there's got to be a better way. And really, that's the world we're in now. The world of, doing fecal transplant opened up our eyes as gastroenterologists to, wait a minute, I fixed one kid. What did I do in one kid that fixed his Crohn's disease? And why can't I reproduce that in another kid? Why can I fix one and not the other? So I think that's getting doctors to start asking questions, and it's getting us into the gut, and it's getting us into the microbiome. In a way, I think the public, the world is excited about this because they want answers. They feel in their guts that there's something there that started.
Yeah.
And so this is an exciting field. This is an exciting field for GI. It's keeping up. It's keeping us away a little bit from just doing procedures and writing prescriptions and being more of scientist. And that's what I've had to become, is a scientist in the lab, to look at microbes, to see what microbes are doing, to see what microbes are doing in people with diverticular disease, to see what microbes are doing with people with reflux, with people with Crohn's disease, ulcerative colitis, etc. So it's fascinating.
Do you think we seeing an epidemic of some of these diagnosed conditions? Like I didn't hear about Crohn's until the last, or maybe colitis, the last 15 years. Now you hear it all the time.
Yeah, yeah,
Diverticulitis. You hear it all the time. Do you feel like that's increasing?
I think overall, all diseases are increasing, if you ask me. You have
Ugh.
Crohn's disease has gone up, ulcerative colitis has gone up, diabetes, obesity, heart disease.
No,
I
sure.
think all these diseases are increasing. We're gonna have a big problem in the next
Yeah.
decade with cancer. I think we're doing something overall, in the world that is creating that change in the microbiome. I think if I look at it as, an overall problem in humanity, we're definitely affecting the microbiome of humanity. These diseases, if you look at what we discovered with COVID, which was finding COVID in the stools, and then discovering that COVID, if you had COVID, you ended up having loss of bifidobacteria, which was an important microbe that newborns have, which is the $1 trillion industry of probiotics. When you start looking at, bifidobacteria, and you start looking at Crohn's patients, and you notice, wait a minute, Crohn's patients that have not been on medications have zero bifidobacteria. Then when you start looking at patients with Lyme disease, and you start saying, wait a minute, patients with Lyme disease have zero bifidobacteria. Then you start looking at
Mm.
patients with invasive cancer compared to people with non-invasive, right? You're thinking, your
Mm-hmm.
basal skin cancer versus your
Mm-hmm.
pancreatic cancer, right? The pancreatic cancer has zero bifidobacteria. So you
Mm.
start seeing bifidobacteria, this important microbe. We could almost see that it has a huge part in immunity. What is killing it? What got us to this level where we have so much disease, so much Crohn, so much Lyme disease, so much, you know, um, cancer, invasive cancer. Think about invasive cancer in the kids, right? I mean, when a
Mm.
29-year-old dies of colon cancer spread to the liver, in 6 months, there's a problem there. Something happened. So what did we do to that kid that started growing normally, and then at 29 he developed colon cancer and now is dead? So this is something that we have to pay attention, because the loss of bifidobacteria is something I take seriously. When I discovered it, it was something that I realized with COVID was a problem, When you looked at severe COVID patients, they had zero bifidobacteria versus people that were exposed to COVID patients and never had COVID, had a lot of bifidobacteria. Your newborns that barely had a sneeze during COVID. These babies have a lot of bifidobacteria as opposed to the old people that don't have any. So I think bifidobacteria is really the bacteria that kind of got us to start paying attention. And I think because of that, we're seeing these, I don't want to say it, epidemic of problems and diseases that are going up. Absolutely. We're killing the microbiome. This is just one microbe, by the way. Imagine other microbes like lactobacillus, which is, practically disappearing in humans. And one wonders, well, is this why people can't tolerate dairy anymore? So
Right.
it's fascinating.
Um, then why don't we oversimplify it and just put it in the water?
Sure.
Why don't we
Put it
put
in the water. Bifidobacteria
bifidobacteria?
in
Put
the
it in the
water.
water. We know, well, because remember they tried to do that with fluoride, and that ended up
Yes.
being a trick bag. I drink water without fluoride, so I don't trust the government on what's best for my health. But in this case, I mean, if this is something, or why isn't this a supplement that we're just as we say, everyone take vitamin D, everyone take this certain
I,
bacteria to strengthen our guts.
And I agree with that up to a certain point, right? The problem is it needs to reach the cecum, which is the end of your colon. So it has to bypass the stomach, which is
Mm-hmm.
full of acid. It has to go through the small
Mm-hmm.
intestine, which, if you stretch it out, is the size of a tennis court, and then has to end up in the
Right.
cecum. So for that one pill of, probiotic, and I have actually, a capsule here that I'm going to kind of show you, for that little capsule here full of probiotics, let's say, it has to travel all the way and then empty. Is it, first of all, is that capsule alive or dead when they created that, right? Is the capsule safe for your
Mm-hmm.
microbiome to begin with? And is it releasing exactly what you need it to be released? So there's a lot of factors to
Mm.
just say, so that if we could say, well, let's put it in the water. The problem is, what are you doing to the water system? Are you altering the water system and the microbiome of the water by doing that, right? We tend to be reactionary. We do, action lead to a reaction. So we panic, we do this. I think the most important thing is realizing that, look, eventually it's going to regrow, but we just got to figure out how to stop killing it, right? Because I think in one hand, yes, you can give
Okay.
it as a
Reverse.
supplement, but then
Right.
if you're killing it, by doing something else, then you're not really doing anything. I compared this, and I tell my patients this. I say it's like basically, you have fire in your gut, and you're putting water on one hand, and then you're putting gasoline on the other. You're never going to turn
Mm-hmm.
off the fire. You got to know what
Mm-hmm.
are the problems that are killing your microbiome to begin with, and that's where we should be focused. So, in my opinion.
Well, let's talk about then hereditary genetics, DNA, how important it is. Because before we started, I was admiring your amazing hair, and I was asking you about your ethnic background, and you have a varied ethnic background. And we
Yes.
then talked. I said that my father was a Russian Jew. You said great microbiome. So my people,
Yes.
resilient that they
The
are, also
resilient
have
microbiome.
good microbiomes.
Yes, yes.
Isn't that interesting? So
Well,
think about what Jews have eaten for years. I mean, and
yes.
and that could be obviously Israel, but I'm talking about Eastern European Jews. But tell me, is that based on where people come from, or
It,
is it more DNA?
it's an interesting, thing. It's doctors will say, it's all genetics. I tend to think that it's more microbiome. We're going to be showing that the microbiome is
Wow.
passed on from mother to child. So here's the interesting thing, right? Is is it the genetics that's passed on through families and therefore causing the problem, or is it the microbes that are passed on from families and therefore causing
Wow.
the problem? When you look at, for example, the Ashkenazi Jews and the persecutions and the exposure to, concentration camps and pogroms and all that, you wonder, were they exposed to certain microbes that basically were passed on from generations to generation, and
Mm.
therefore that microbe causes the problem, right? So that's the path that I'm going on anyways. I've kind of,
Mm,
I pride myself as a scientist to be the complete opposite of everybody else, because I feel like if everybody's looking right, then why do I need to look at right? I need to be left, because that's where the answer might be, right? If everybody's, looking for gold in one mountain, I'm going to go to the other mountain to look for it, because first of all, it's less crowded. So it's definitely less
right. I
crowded,
like the way
although,
you think.
but the crowds are coming into the microbiome space, sure enough.
I
So,
know. I know.
so I
I know.
think it is the holy grail. It is, when you think
Hmm.
about the process of death, is really microbes in your gut eating your body and putting you back into the ground. These microbes, you kind of acquire them through life so that they can start taking over your body, and eventually they put you back in the ground. But think about, those microbes are still alive under the ground, revamping themselves, going into the roots of a tree, going into an apple, going into a human. The whole system is just, it's a beautiful system of, the circle of life, right? This, it's a cycle. So when you look at generations and you look at, the resilient microbiome, and you look at, the Jewish microbiome, that's still standing, you got to say, well, maybe there's something to that, right? You can't kill them. They keep coming back. Maybe there's something to the microbiome. Maybe we shouldn't be focusing on killing them, right? Maybe that resilience is what we should all acquire. So here's an interesting other thing is that, and that's something I've kind of discovered. When you do fecal transplant, it is never really the person that you think is the perfect match for another person, right? It is usually the person
Oh.
that is completely separate. So it could either be someone in the family that we pick, right? That's kind of a
Uh huh.
similar, or it could be
Hmm.
somebody that's completely separate, that is having the microbes that you're lacking. So, in essence, what's the beauty of the microbiome that I find is that, yes, the diversity of microbiome creates health, right? That's the whole thing we discovered on the microbiome. But here, when you look at, and you were talking about genetics and races, etc., and, being Russian or being Irish, think about the diversity in that microbiome that's different, right? Think about the Irish microbiome that's eating a certain food, and think about the
Right.
Mexican microbiome that's eating another food.
Right.
Here's one thing I discovered as a GI doctor through years of asking questions to my patients. It's interesting that it's always the Mexican that starts eating sushi starts having problems, and the Japanese that starts eating Mexican changes their diet completely, starts having problems. Or the guy that was never eating breads, and all of a sudden someone told him, "Hey, you need to eat, multi-grain bread," and then all of a sudden develops problems, right? So you have to ask
Mm.
yourself, is there a racial microbiome? Is there a
Hmm.
localized area of the planet microbiome? When you look at the Japanese in Japan and you look at the Japanese in America, it's a different microbiome within the same family. And I've looked at
Right.
that, right? Because we're always looking at, kids with autism, etc. And one of the things that we discovered was basically when you give a child when you compare a child and you try to find a match for that kid with autism, and you take from his family that's in China and he's Chinese in America, the microbiome is very different. There's still some signature features that are similar, but it is still different because of that, change in the environment. So you got to wonder, is the change, you see people that are moving, right? People from Egypt that move to America, or people from Portugal that move to America, or vice versa, Japanese moves to Spain, and then their microbiome is not their gut. They start having gut problems. You wonder if it's the change
That's so
of the
interesting.
environment, the change of the food. I was just in Brazil with my little one, and my little one eats junk food like crazy, nachos. And, Brazil is not the, no, she has the worst diet in the history of diets, per the American diet, but honestly, a good microbiome. So she goes to Brazil, and of course, it's
Wow.
all healthy food over there. and real fruits and real, because we went to areas that were really far from the beaten path, and really trying to expose them to, good microbes in the earth, and good avocados and good mangoes and good coconuts, right? Anyway, she was having digestive problem the whole time. And I
Really?
have to say, because she stepped away from her regular diet, that was her comfort zone.
Wow.
Yeah.
So you're upsetting the apple cart,
You're
your own apple
changing your
cart.
microbiome. You're basically, changing it. Now, at some point it reestablishes, and you reflor the process that I like to call refloralization, which is essentially putting new flora in your gut and adjusting to that flora, to that new flora, which is really your immunity, in my opinion. So the more you can expose your kids to things and kind of like toughen
Yeah.
them up to that, okay, it's going to pass your digestive issues. You're going to just you're going to adjust and be fine. But then there are some kids that just don't tolerate that, and that have a specific microbiome, which then brings the question of is there such a thing as a microbiome and colonic receptor, right? So is the microbiome of the gut linked with the receptors of the colon? Do these, microbes sit on receptors in the colon that are specific for that person? So it's really, it's amazing, because it really is a fingerprint, that we see in the microbiome of individuals. When you go super deep to look at the microbiome, you see a fingerprint, almost like, a
Huh.
DNA
Unique.
of microbes.
Yeah.
And that's unique to you. Like I'm matched to my
Mm-hmm.
oldest daughter in our microbiomes, and we actually look the same, and our personalities are the same, that we actually butt heads because
Really?
we're so
Right.
similar.
So much alike.
Yeah,
Mm-hmm.
but my husband and my little one are very similar in their microbiome and in their personality. And so me and my younger one are like more of a match, like me and my husband. And the two of
Right.
them are kind of, it's interesting to see that, you know, because my oldest daughter will always say to me, Mom, I'm so different than you. I'm like, no, you're not. We look the same, and we're matched in our microbiome. So we're not,
That is
so
so
different.
funny.
So it is kind of funny. And
That is so
it,
funny.
it becomes even funnier when you start looking at kids with autism, where you see one kid that's neurotypical, has a perfect microbiome, and another kid with autism has an abnormal microbiome. So you could see the differences.
Wow.
Yeah.
I'm thinking of this story, or my own story is that my son just married a girl from Sao Paulo, Brazil, and
Oh,
they are living with us until he gets sent off. He's an engineer, and they're going to match him to
yes.
his location. He just doesn't have a project site yet, and so we are learning so much about Brazilian food and culture. In fact, we're recording this the first week of January, and in Brazil, they wear yellow and green underwear for good luck on New
Yes.
Year's Day, and we eat black eyed peas. So she thought black eyed peas were a band. She didn't know it was a food, and
Oh my
the good luck
God.
food. So we've introduced all this food to her. But the one thing I've noticed, I'm not a gluten eater. Just because of all my autoimmune conditions, I wonder about
Right.
the glyphosate. Really, not the gluten. I don't have a gluten sensitivity, but we all have a glyphosate sensitivity. I think we can agree with that.
Yes.
But it's funny with her here, we keep foods that are very familiar to her. She wants bread, rice, beans, meats,
Yes.
and we don't have the exotic fruits. We can't get them in the US
No,
or
you
where
can't.
we are landlocked in Little Rock, Arkansas.
No,
There are
and
things I've never
actually,
heard, not plantains, but there are other things I've never heard of.
yes.
But what's so interesting is how we run from gluten in the US, or maybe it's a niche market and it's cool to do it,
Right.
but she's never heard of that. Well, the other thing is, the people, they ate what was served to them. There wasn't a lot of choices, and they had a lot of meats, beans and rice and bread,
Right.
and the pão de queijo, the Brazilian cheese bread that's made with tapioca flour, which is gluten free.
Oh yeah, yeah.
But
That's
she
my
has
daughter loved those tapioca crepes. Yeah.
Oh, she makes them here all the time. I mean, you end up eating them
So
like
funny.
candy because they
Yes.
pop them in your mouth like a donut hole. Yeah.
Yes.
But I eat them because I'm trying to stay away from gluten. But it's funny how the things that we have villainized as foods, she embraces. She embraces carbs. She's the size of this pin. I mean, there's
Yeah.
nothing to
No.
her. She's
No.
skinny as a stick. But
Yeah.
is that her microbiome that
That's
has
her microbiome. Yeah.
navigated her?
Yeah. Yeah.
Well,
I have
I want
kids.
her microbiome.
Let me tell you, I have kids that are my super donors, and they basically eat what
Mhm.
I consider junk food, right? Pizza, nachos, French fries. And they have an amazing microbiome and they're super slim, right? I wish I had that microbiome. I've lost it. I used to have that microbiome. I would eat like a Subway sandwich,
When
no
we were
problem.
younger, yeah,
Yeah, but is it because we're young? We were younger because we had so much good microbes, or is it because
yeah,
of the stress of our lives and everything else we've
yeah.
put into our bodies? From alcohol to antibiotics to everything we've put into our bodies. Did we decrease our immunity? We decrease our ability to metabolize foods? I think so. So
So
yeah.
alcohol is an enemy to our microbiome, correct?
Uh, there's studies showing one glass of wine, one glass of tequila is good for your microbiome. I think 10 more than that is not good. It's a sterilizer if you think about it. What is alcohol? It's a sterilizer. So,
Yep.
I tend to tell patients to stop drinking because you're killing everything. And then once you've killed it, now you can live with a sterile gut, right? Like you can live in a
Mhm.
bubble fully sterile, or you can live with a diverse gut and be in the forest and be in the garden and be planting and be, like in the Amazon jungle. So it all depends which side, but you cannot go from like sterility to dirt without having the proper immunity to fight off, that environment. So, and that's the problem that happens. So you see people that were living a life of sterility and they're catered, and then all of a sudden they decide they're going to go to India and go barefoot on the
Right.
ground of India.
Right.
Big mistake. You're now
Right.
a reservoir that's empty, an empty vessel for parasites to come in. Those parasites are going to find ways, and then you end up coming home sick, and then you go, oh my God, what happened to me? So that's
Right.
it.
It's a There's a researcher, well, Brian Sanders has a site called Food Lies, and he's starting a film. It's really fascinating. And he went during COVID to Africa. One of the countries, remember, was open. They were like, "We're not
Yes.
acknowledging COVID. It is
Yes.
not a thing. You can't wear a mask." And they
Right.
drink poop water. He said it is
Yes.
literal poop water. He said
Yes.
because his microbiome is from Austin, Texas, and
Yes.
it's very Western. He said it would
Clean.
kill him. He goes, but the
Yes.
people there thrive. They're barefoot. They hunter
Yes.
gatherers. I mean, it's a fasting.
Yes.
I forget the name of the tribe,
Yes.
and a lot of people know it. But it just shows that really location, location, location has so
Location.
much to do with your health.
100%. And I'll tell you my own story. So I was born in Morocco, and, my parents,
Oh,
I mean,
beautiful
I
part of the world.
remember, but Morocco back then, I mean, it was just, it wasn't like it is today. But even today, it's not, as modernized as America is, and as, the
Right.
food still tastes like foods and the fruits still taste like fruits. But I was born in Morocco, and I remember my parents taking me to the desert and taking me to all these places that were just so off the beaten
Mm-hmm.
path. And then we moved to
Mm-hmm.
Montreal, Canada. Microbiome takes changes there. And then I moved to
Yeah.
America, Florida, California, New York, etc. And I got to tell you, I went back to Morocco last summer, and I had a toxic E. coli that almost killed me.
Oh,
Now, here I had gone to Morocco as a kid to the same place that I was there drinking that water, right? So I was exposed to E. coli back then, didn't really affect me. I
but you fought
leave that
it.
environment. I killed my
Yes.
microbiome because I've now, lost a lot of diversity that I had from Morocco. And now I've gone to Montreal, sterile country, to America, over
Yes.
sterilized,
Yes.
eating all those salads with the pesticides and everything, and drank
Yes.
the alcohol, and had a lot of stress, and took antibiotics and vaccines, etc. Killed my
Yes.
microbiome over time. Next thing you know, I go back to Morocco. I'm a sterile gut. You know what I mean? I've not been exposed to
Wow.
that environment. It nearly killed me, but somehow what doesn't kill you makes you stronger. So it was fine. But
Yeah.
I know exactly where I got it. It was in the desert, and I was asking for ice in the water. Big mistake, because I drank the water bottle, but I asked for the ice. The ice came from the local water. So, we don't think
My
of these
daughter
things.
my daughter just had this happen. She travels the world, got E. coli in Greece 2 years ago, had some watermelon, and then went to Thailand last April, got typhoid fever, got septic.
Yeah.
She drank some water in a village, walked barefoot with the natives,
Yeah.
in the mountains. She went
Yeah.
down to Phuket. She was also on the beach, so we did think it was dengue fever or malaria,
Yeah.
but it was that, though she eats a very varied diet, but still a Western. She's from the U.S.,
Oh,
but
yeah.
she couldn't take it, and it almost killed her. I mean, I'm
Yeah.
laughing now because she's totally healed, but it was such a scary time. And now I'm seeing geographically. So, how do we protect ourselves geographically when we travel if we want to embrace the culture?
So I think, the first thing is, you're going to be hit if you're going into those areas, right? So make sure your vitamins are up to par. Your vitamin C, your vitamin D level is up to
Okay.
par. That's the one thing.
All right.
With the E. coli, what I did was I did bovine. I have this bovine immunoglobulins that I make for my patients with inflammatory bowel disease, etc. And we actually just published on bovine immunoglobulins. So I'm very,
Wow.
very keen on, you see me, I analyze the poop of the cows because I want to make sure the poop is fine. So I had a study. No, because listen, I don't need to kill the cow to get the blood to basically make sure the blood is safe, right? I can see the stools, and from the stools, it tells me whether the cow is healthy or not, in my opinion. So, anyways, so I tested the cows for this particular product. I tested the bovine. So I had an interesting case of a patient with Crohn's disease that I gave bovine immunoglobulins, and the patient actually resolved his Crohn's symptoms with bovine. And it turned out that he had a bacteria that was a Bacteroides category, which is one of those bad bugs, for him. Anyways, had an overabundance of it. So what happened is I gave him, on a whim. I was doing a clinical trial with a pharmaceutical company that was owning the company, that was basically owning the bovine immunoglobulins at the time. And they said, well, it's a good nutritional supplement for Crohn's patient. You should try it. So I said, well, this patient really wanted fecal transplant. It wasn't available in America. It's still not available for Crohn's disease. So I said, well, why don't you try this bovine immunoglobulin, right? So he started taking like one scoop of the bovine, and he took it for about a month. All of a sudden, his symptoms improved. His fecal calprotectin went down. His CDAI was better. So I actually published on the case on the Progenobiome website to showcase this case. So bovine immunoglobulin was like something I used for this case, and I realized early on that it kind of dropped those Bacteroides, right? So when COVID hit, I had a couple patients that had those long haulers, right? Those leaky gut. So I basically decided, well, you know what? I'm going to start giving some bovine immunoglobulins to these patients and see if anything happens. And lo and behold, they started improving. So I became
Wow.
obsessed about bovine, and I decided, let me look into it, right? What is it doing? So we actually started giving it to like 20, 30 patients and published. And last year we presented at American College of Gastro. It actually increases the bifidobacteria, decreases the Bacteroides,
Oh, there
decreases
you
the
go.
proteobacteria, which is E. coli. So guess what happened when I was
Right.
nearly dying with E. coli in Morocco? I came home and I was starting to do my clinic. I was so exhausted and so sick from, back and forth to the bathroom with E. coli that I went home and I said, I
Yeah.
can't do this anymore. I'm
Yeah.
just going to take this bovine and just
E.
take it.
coli's bad. Woo.
Within 4
Yeah.
hours, I was back to normal. So it swallows, the bovine swallows the E. coli, it binds it and then flushes it out of your system. So it is something that I discovered. And so because I am, uh, careful about these products, I kind of joined up with the company and said, look, I'm going to start, testing it. I'm going to start giving it to my patients. And so that's one thing that I carry with me. If I was stuck in a desert, if
Oh,
I'm going
right.
anywhere, I take my little powder with
Duly
me.
noted.
Yeah,
Right.
that'll save you. The second thing that'll save you is a good source of vitamin C. Making sure that the vitamin C does not have any, contaminants in there, that it's a good company that sells it. That I was stuck like you, like your daughter in Thailand, and my husband had, and that's probably the first time that I started looking at the whole, importance of vitamin C. My husband had a high fever. My youngest one had a high fever. I did not
Oh,
want to catch what they had. And we
yeah.
don't know what it was, probably MERS at the time. They were super sick. So me and my daughter decided we're going to pop some vitamin C like crazy just to not catch this. And we didn't catch it. Well, fast forward to COVID. If you remember, my protocols were hydroxychloroquine, Z-Pak, vitamin C, vitamin D, and zinc. So vitamin C, vitamin D, we discovered increases bifidobacteria. That's how it helps.
Oh,
So,
on
and
it.
we published on
Yes.
that, by the way. Vitamin D also increases bifidobacteria. Zinc increases lactobacillus. For those people, and we're actually doing
Okay.
clinical trials right now, for those people that are lactose intolerant, we are basically, you know, giving them vitamin C, D, and zinc to see, a specific vitamin that we basically created just to see if that's improving their lactose intolerance. Because we had a couple cases where people say, you know what, after 3 months of being on your vitamins, I'm starting to eat dairy. So I think vitamins, nutrition is very
Wow.
important. The right supplements, the right quality products is
Yeah.
very important. So if you're going abroad, I have like this thing now that I have this emergency pack that I take when I go abroad. Ivermectin is one of those because you never know.
Yeah.
You could catch a parasite. You could have like
Right.
one of those weird infection. Well, you know what? Ivermectin may be a good pill to have in your emergency packet. And by the way, scabies and lice is still out there in those countries. So,
Is that right?
and scabies and lice, ivermectin does a great job with scabies and lice. They were actually, my sister did the clinical trial that brought ivermectin to market. So I know very well. That was what was bothering me about COVID the whole time was, wait a minute, we're giving ivermectin to babies with lice, and we can't give it to people that are dying with COVID. Made
That's
no sense
ridiculous.
whatsoever.
That
It was
was
so ridiculous. And then
oh,
calling it a horse pace and
I
all that, I just like lost it.
uh, just ridiculous, and it got so political so quick. I
So
thought we were
polite.
in the business of helping people. Yeah,
And then
it just
yeah,
absolutely
that
drove me
was the
crazy.
one thing this pandemic that bothered me was like it was supposed to be the time where you could shine and help your friend or your neighbor. And instead it
Oh no.
became, a price of a stock. That's what it was all about.
Yes, and you end up virtue signaling that I've had 19 shots and boosters and I wear a mask and you don't, so you're a sinner.
Right.
I remember wearing a mask around town because I thought I don't want to be posted on social media as, you know, a bad
Right.
person. And
Right.
but that virtue signaling pressured me into doing something I didn't want to do. I won't do it again. But
It,
I mean, I
and it
regret
made
that, but it's
no sense. It made no sense for those who were healthy to wear a mask. I can understand a person
cancer
sick, they're
patients wear a
coughing,
mask.
cancer
Right.
patients. It's freedom of
Absolutely.
choice,
Absolutely.
100%. You're
Thank
immunosuppressed,
you.
but you're healthy. Why would you want to put a mask that
Oh,
is
God.
accumulating
Right.
a bunch of microbes back and forth? Your
No,
immunity is around you. It's you're accumulating immunity from your air. You want to be hiking. My biggest thing in Malibu was when they closed the beaches. And that's when I
now was
basically
that not
said,
a
okay,
joke?
that was, I lost I lost
Oh
faith
my
in our
gosh.
government when that happened. I said, this is ridiculous. A bunch
They
of
were
idiots are
arresting
running the
people.
show. Yeah,
They
I
were arresting
remember
people on beaches and
the beach.
parks,
I'm
but
like,
but
it's salt water.
it's
Salt
salt water, which is what
sterilizes.
I do when I don't feel well. I use salt
Yeah.
water, but they kept the strip clubs open and the liquor stores.
Yes.
Yet they
Yes.
closed beaches and churches. That uh, if that
Yes.
wasn't politically divided, nothing was. Okay, so I can't believe how fast this interview is going. Progenobiome is your company. Can I buy
Yes.
some bovine immunoglobulin there?
Yes, yes. So it's a biomeboosters.com. You can get it from there.
Okay,
Yes. So we put it out
okay,
there, for the public, and I'm always available
all right.
uh,
I'm writing that down.
on that. So
Now, all of this will be in our show notes. Excuse me. Sorry, I've got a tickle in my throat talking about it. And what about ivermectin? Can we get that? We can get that over the counter, right?
no, you can't. It's not. Some states I think have it over the
Oh,
counter. Some states have it over the
that's what I thought.
counter.
I thought
It's
in Arkansas it was we could get it at the feed stores
yeah. So you can get it
because we
from
have a
like
lot of livestock.
So specialized pharmacies is what I recommend people to go to. There's a lot of specialized pharmacies that
Okay.
actually dispense it. And listen, people eat sushi, raw fish all day long. The likelihood that they have a parasite
Now,
from the sushi
what do you,
is really high.
what do you think about that? Okay.
So it
Okay.
gives them an in to getting the ivermectin in the event that, they can't get it for whatever reason. I personally think it's not something I would take on a regular basis, but if you're stuck in the middle of nowhere and you're super sick and, why not? It's not a bad drug. It's a safe enough drug. Definitely, was a huge player for me for COVID patients. When I had patients that were desaturating in the 60s, and I saw it went from 63%
Wow.
to 82% after giving ivermectin. And why? Because it actually increases bifidobacteria. We showed that on the data at ACG again. So I think, there's going to be a time where we're going to start looking at these microbes, kind of like looking at a hemoglobin of a blood test, and seeing whether a
Yeah.
person needs a blood transfusion. There's going to be a time where we're going to need to look at these microbes and say, patient is missing bifidobacteria. Here's a little bit of vitamin D. Here's a little bit of vitamin C. Here, maybe we, can give them some ivermectin. They're doing cancer studies. I told you about loss of bifidobacteria in invasive cancer. They're actually doing studies on cancer and ivermectin. So it's an exciting new world. Hopefully, it's a world that's not going to be censored too much and allow us as physicians to see the
Well,
truth. It's that's the
depending how
problem.
people vote.
I agree. I agree. Yes.
And depending on what message who you're watching, what you're listening to, I've made it very clear, and I'm a longtime journalist. I haven't turned the TV news on since March 10th, 2020. Don't know who's on, don't care, because I don't choose to get. They were using scare tactics in the beginning, and so
Yes.
I choose to get my news from my device, from the sources I trust.
Yeah,
And
that's
so,
how you do it.
because I see people get brainwashed and
A
running to
hundred
the hills
percent.
that we're all on fire, and we weren't on fire. We
I,
weren't on
I was
fire.
so
In fact,
fortunate
I
this
mean, just
pandemic.
ugh. I mean,
No, no, no. I was so fortunate this pandemic to be linked up with some good, righteous physicians, working with Dr. Tom Barodi, who was the father of fecal transplant, working with Peter McCullough, working
wow.
with Pierre Corey, working with all these guys.
Yeah,
And seeing the truth, Keith
but
Berkowitz, I mean, there's so many good doctors out there, Sheldon Jordan, and so many physicians that have been really trailblazers, in medicine. Sheldon Jordan is like the top neurologist in the world, in my opinion, and Sasha Bistritsky for anxiety and psychiatry. So to be able to work with these guys and to trust them, because at the end of the day, I'm not going to trust a politician with my life. I'm going to trust a guy who wrote a book on the disease, right?
and
When I
isn't
tried
bought and paid for. Is
and is
that's the
not
other thing.
bought and
It's
paid
finding
for.
out who did the research. Yeah,
Yes.
it's really
And
really
who is
scary.
doing the
Doc-
research for the solving the mystery of the problem, not paid to sell a drug? That's a big difference.
I know. I mean, it just makes me crazy when people come to me, and it's the same thing. Just because I'm a health coach, I don't give medical advice, but hearing that someone wants to put them on a statin because their cholesterol's 202, I go, the
Right.
cholesterol's not going to kill you. But
Right.
but they're saying, but my doctor said, well, your doctor is educated by the people who get to go to really nice vacations because your doctor is writing the prescription. I mean, just
I
follow the
think,
money is what we said
yeah,
during
and I
COVID.
think also there's the doctors have been, it's not even about the money, it's the doctors have been handcuffed. You saw it with COVID. They were afraid to
Yeah,
write
yeah, for sure.
drugs for,
Oh, especially in
yeah,
California. In
yeah,
California, you all
you
couldn't
couldn't
even,
say
you had
anything.
to recommend. Yeah,
Yes. You had to recommend,
your mouth,
yes.
woo, zipped.
Yes. And we
Oh,
had to fight for
that
that
that's
AB
tyranny.
2098, that law that basically tried to censor us,
Yeah,
And here's
I
the
know.
problem is at the end of the day, those politicians are going to be patients. We're all going to be patients. So,
That's
you
right.
know, we cannot
That's right.
interfere with research. We cannot interfere with science. Science has to be unbiased. Even me, I'm in this field and I have a genetic sequencing lab. I try to stay as objective as possible. When I started with the whole hydroxychloroquine protocol, and that was my patent, by the way, I could have easily sold it to someone and said, oh, let's develop this protocol, hydroxy, Z-Pack, vitamin C, D, and zinc. It's the answer to COVID. But what I discovered was that it was not the answer for everybody. It was the answer for the people that were like really sick, that had zero bifidobacteria, but it was not the answer for the young, healthy person because it could affect their microbiome. So I started saying, well, I don't want to push this drug because then everybody's going to start thinking that they all should be taking it. Then we're going to kill the microbiome. So there was a better option for the young people. There was a better option. Ivermectin was a better option. Doxycycline, zinc was a better option for young people. And then vitamins alone became a better option for young people. You know what I mean? So I think we have to stay,
Hmm.
objective. We have to stay humble. We have to stay legit because when we become the patient, then it backfires on us, this, changing the data and altering the data. And unfortunately, we are living in a world that is manipulating data right now. The pharmaceutical companies are corrupt and bought. And I've been in the field for 30 years doing clinical trials. I've seen the progression. I've seen to where we are here. This is no longer about science or medicine. So,
Dr. Hazen, on that, we're dropping the mic. That's what the kids say when your point has been made. Thank you so much for being
my
here.
pleasure.
All information about Dr. Hazen on in the show notes. And everybody, let's drink up our bovine immunoglobulin. I'll drink to that.
Thank you.